Sir Isaac Newton once said that we see so far because we stand on the shoulders of giants, and certainly he was such a giant. And many, many surgeons, not only in Canada but worldwide, including myself, have had the privilege of standing on his shoulders. And this is why I've always considered him to be a real Canadian titan of surgery.
Professor William Edward Gallie was born in Barrie, Ontario in 1882. In a career that spanned 5 decades, he served as surgeon, scientist, teacher, administrator, and senior statesman, and excelled at them all.
Professor Gallie was the most remarkable man I think I've ever known in medicine or in surgery. He was a huge individual to start with, a very large man, about 6'5", and a very gracious and generous man, a very kind man. He had time for everybody. He had time to listen, which is a very important art in medicine, of course.
He was a very caring, understanding person who I think felt he had a great obligation to the people he dealt with. And I think he proved that through his lifetime in surgery.
The greatest feature of him that distinguishes him from many around him and today was leadership, real leadership. And in that he had a huge vision, which he accomplished because of the clarity of his vision. And he, at the same time, as I said right at the beginning, cared about real people and put real people first, knew people directly, and dealt with them that way. So he didn't let his ambitions for great visions demean anyone. And that was the fundamental essence of the great leadership.
In the early part of the 20th century, it was unusual for surgeons to undertake research, but Professor Gallie wasn't satisfied with the current state of knowledge. He was anxious to develop new ideas.
Saint Georgi, a great scientist, Nobel Prize winner, once said that the secret of success in research is seeing what everyone else has seen, but thinking what no one else has thought. And it was this thinking process that made Professor Gallie stand out. He saw the poor results of some of the treatments that were being done for, say, big hernias or for recurring dislocations of joints. And because of his experience there, he decided to develop something completely new, which was the development of stitches that were made of living tissue, taken from the tissue just deep to the fat layer in the side of the thigh, called fascia lata. It was a great advance, and he used this for hernia repair, but more significantly, I think, for such conditions as recurring dislocation of the shoulder joint, for dislocations and subluxations of the kneecap.
When Professor Gallie graduated in 1903, medical training still worked on the apprentice system, where a student would work with an established doctor for 2 or 3 years and then begin to call himself a surgeon.
Professor Gallie changed all that, and he was the first person really worldwide to develop a completely organized training program that included some time spent, say, in internal medicine, some time in pathology, some time in general surgery, and then time in a particular specialty. And this became known as the Gallie course in Toronto, but it became known as his training system and used all over the world.
Because he was a world leader in moving surgery and medicine forward to be based on evidence and appropriate, rigorous, planned training. That's a huge accomplishment.
Graduates, members of the Gallie Club, also known as Gallie slaves, moved into senior surgical positions across Canada and abroad. But Professor Gallie's contribution to the teaching of surgery extended even further.
One of Professor Gallie's most important contributions to Canadian surgery was developed through his close friendship with Colonel Sam McLaughlin, who at the time was the president of General Motors of Canada and a very wealthy individual. Dr. Gallie was able to convince Sam McLaughlin to donate a large amount of money to create scholarships in Mr. McLaughlin's name.
Dr. Gallie said, you know, what we need in Canada is a foundation that will support trainees in such a way that A, they're well supported while they're away, their wife will accompany them or their family will accompany them, they will be promised a university job before they go, and they will be promised a hospital appointment before they go. And Mr. McLaughlin thought that's a great idea, and he set up the McLaughlin Foundation. And as a result of that, over 1,000 Canadians are McLaughlin Fellows.
Before he retired, Professor Gallie had served the University of Toronto as Dean of Medicine and Professor of Surgery simultaneously. And among his many honors, he received the Gold Medal of the Royal Society of Surgeons of England, only the 20th recipient in 150 years.
He ranks along with Sir William Osler, who was inducted actually into the Medical Hall of Fame in the initial group. And in many senses, Professor Gallie, from a historical point of view, is to surgery what Sir William Osler is to medicine. And that's the highest accolade that one could pay, I think, to a surgeon.
And at the same time, he turned down offers to move out of Canada to places he might have made much more money, but he was a loyal, dedicated Canadian. He stayed here and made Canada great in surgery and medicine.